Welcome to the CYBHI Fee Schedule Program Onboarding Series, Module 3. DHCS is looking forward to continued partnership with local educational agencies and public institutions of higher education, referred to throughout this series as LEAs and IHEs respectively, to assist in onboarding to the CYBHI Fee Schedule Program. The information shared today is for training purposes only and subject to change. For the most current program requirements, please refer to the CYBHI Fee Schedule Program Manual. Today's module focuses on the Provider and Practitioner Network. Let's get started. Before we get started, here's a quick recap of Module 2, which covered the scope of services. We explored student eligibility, location, and medical necessity requirements for reimbursement. We reviewed the eligible service categories such as psychoeducation, assessments, treatment, and case management. We also discussed an illustrative schedule of a participating provider. Here's a snapshot of where we are in the broader onboarding process. Module 1 gave an overview of the program. Module 2 reviewed scope of services. For today's module, Module 3, we'll focus on the Provider and Practitioner Network. We'll address the key question: how does the CYBHI Provider and Practitioner Network work? In this module, we'll cover 4 key topics: overview of the Provider and Practitioner Network, requirements for being included in the network, the process for submitting the Standard Provider Import (SPI) roster file, and frequently asked questions. Let's start with a high-level view. LEAs and IHEs must designate the individuals or organizations who will deliver services under the CYBHI Fee Schedule program. These are categorized as embedded, employed or contracted directly by the LEA or IHE; affiliated, not directly employed or contracted, but referred to by the LEA or IHE. Whether embedded or affiliated, all designated providers and practitioners must be listed on the SPI roster, meet credentialing and enrollment requirements, which we'll explore next. Now that we understand who can be designated as a provider or practitioner, let's review the requirements they must meet to be eligible for reimbursement through the CYBHI Fee Schedule program. These requirements apply whether the individual is embedded or affiliated. To participate in the network, every provider and practitioner must have a valid NPI, either Type 1 or Type 2, depending on their role. Be enrolled in Medi-Cal, either as a fee-for-service provider or through ordering, referring, or prescribing only enrollment, depending on their care delivery role. In the upcoming slides, we'll walk through specifics on the NPI and Medi-Cal enrollment requirements. Let's start with the NPI requirement. An NPI, or National Provider Identifier, is a 10-digit number that uniquely identifies healthcare providers and organizations. There are 2 NPI types. Type 1, for individual providers, like clinical social workers or psychologists. Type 2, for group entities, such as clinics or LEA or IHE organizations. Every designated provider or practitioner must have an NPI, unless they are part of a consortium and not submitting claims directly. To apply for an NPI, providers can apply online via the National Plan and Provider Enumeration System, or NPPES, at nppes.cms.hhs.gov. The process typically takes 10 to 20 business days. If you're not sure whether a provider already has an NPI, you can search by name on the NPPES registry webpage at npiregistry.cms.hhs.gov/search. Up next, we'll explore Medi-Cal enrollment, which is the second requirement. There are 2 main types of Medi-Cal enrollment pathways depending on the type of provider and their role in care delivery. Medi-Cal Fee-for-Service, FFS enrollment. This is for licensed practitioners and organizations who want to both render services to Medi-Cal beneficiaries and seek reimbursement for those services. For example, if a licensed clinician or an LEA or clinic wants to submit claims and get paid for providing eligible behavioral health services, they need to enroll in Medi-Cal Fee-for-Service. For organizations like LEAs, IHEs, or provider organizations, fee-for-service enrollment allows them to bill directly for services rendered by their team members. Medi-Cal ordering, referring, prescribing, ORP only enrollment. This is a limited type of enrollment that applies to licensed practitioners who only want to order, refer, or prescribe services, but not actually render them or get paid directly for them. These providers cannot submit claims or get reimbursed directly. This is common for medical professionals whose role is more consultative or who support care delivery through prescriptions and referrals. It's important to note that ORP-only enrollment does not apply to organizations, only individuals. This slide offers a side-by-side summary of Medi-Cal enrollment requirements for the three types of participating entities under the CYBHI Fee Schedule program: LEAs and IHEs, designated provider organizations, and designated individual practitioners. LEAs and IHEs. These are educational institutions acting as the program provider. They must enroll in Medi-Cal fee-for-service in order to bill for services, unless they are part of a consortium model where only the lead LEA or IHE needs to be enrolled, as long as the other members don't bill directly. Designated provider organizations. These include organizations like hospitals or clinics that employ practitioners. If they want to receive reimbursement directly, they must enroll in Medi-Cal fee-for-service. Otherwise, if the LEA or IHE bills on their behalf, enrollment may not be required. Designated individual practitioners. These are professionals who order, refer, prescribe, or render behavioral health services. They must be enrolled in Medi-Cal fee-for-service or as ORP-only providers, depending on their scope of work and role in care delivery. This is a high-level overview, and we'll go into more detail about each of these categories on the following slides. Let's now look at the Medi-Cal enrollment requirements for LEAs and IHEs participating in the CYBHI Fee Schedule program. Policy background. LEAs and IHEs must be enrolled in Medi-Cal fee-for-service if they plan to receive reimbursement directly from the billing provider for Medi-Cal claims. Requirements. To meet this requirement, DHCS requires all LEAs and IHEs to be enrolled in Medi-Cal fee-for-service. That said, there is flexibility in consortium models. Only the lead LEA or IHE must be enrolled in Medi-Cal, as long as participating members do not intend to receive reimbursement directly from the billing provider. This setup allows smaller or resource-limited LEAs or IHEs to participate in the program without needing to complete individual Medi-Cal enrollment, provided they work through a designated lead. How to enroll. To enroll, LEAs and IHEs must obtain a Type 2 NPI, submit a CYBHI Fee Schedule Program Provider Participation Agreement (PPA) to DHCS. Once approved, DHCS will enroll the LEA or IHE in Medi-Cal and add them to the Provider Master File (PMF). Let's now look at designated provider organizations, such as clinics, hospitals, or behavioral health agencies, and what's required for them to participate in the CYBHI Fee Schedule program. Policy background. Designated provider organizations must be enrolled in Medi-Cal fee-for-service if they intend to receive reimbursement directly from Medi-Cal for services rendered. This means that if a provider organization wants to bill Medi-Cal directly, they must independently enroll in the Medi-Cal program. Requirements. Under the CYBHI Fee Schedule program, DHCS operationalizes this requirement by requiring all designated provider organizations to be Medi-Cal fee-for-service enrolled if they intend to bill for services directly. However, there's an important exception. If an LEA or IHE will bill on behalf of the provider organization, meaning the provider is embedded or contracted with that LEA or IHE, then separate Medi-Cal enrollment for the provider organization is not required. How to enroll. Designated provider organizations that do need to enroll must do so through the Provider Application and Validation for Enrollment (PAVE) system. They can visit the DHCS PAVE website to start the process, which is entirely web-based. Let's now take a closer look at Medi-Cal enrollment requirements for individual practitioners participating in the CYBHI Fee Schedule program. Policy background. Federal Medicaid regulations require that services billed to Medi-Cal must be referred by a licensed practitioner of the healing arts, LPHA, acting within their scope of practice. These practitioners are commonly referred to as ORP providers, meaning they can order, refer, or prescribe services. The Department of Healthcare Services, DHCS, is required to ensure that all ORP practitioners serving Medi-Cal beneficiaries are enrolled in Medi-Cal as participating providers. An LPHA who is already enrolled in Medi-Cal may act as the ORP practitioner listed on all claims, recommend and refer the service, and include their individual NPI on the claim. Requirements. In the context of the CYBHI Fee Schedule program, these enrollment requirements apply anytime a claim is submitted for a student enrolled in Medi-Cal. Because responsibilities vary depending on whether a provider is billing, rendering, or referring, Medi-Cal enrollment requirements will differ based on provider type and care delivery role. We'll break down those specific enrollment requirements on the next slide. To enroll, providers must use the DHCS PAVE system, which can be accessed through the link shown here on the slide. Let's break down the Medi-Cal enrollment requirements by specific individual practitioner roles in the CYBHI Fee Schedule program. Billing provider. This is the individual practitioner who receives reimbursement from Medi-Cal. In this case, the practitioner must be enrolled in Medi-Cal as a fee-for-service provider. This applies to any provider directly submitting claims and receiving payment. Rendering provider. This is the practitioner who provides the behavioral health service to the student and determines medical necessity. Medi-Cal enrollment is not required if the rendering provider is already a licensed practitioner of the healing arts, LPHA. However, if the rendering provider is not an LPHA, then an LPHA must be listed on the claim as the referring provider, and that LPHA must be enrolled in Medi-Cal. Referring/ordering provider. This is the practitioner who orders, refers, or prescribes the service, but does not provide it directly. This practitioner must be enrolled in Medi-Cal, either as a fee-for-service provider or ORP-only provider, ordering, referring, prescribing only. Understanding these roles and their corresponding enrollment pathways is essential for proper claim submission and program compliance. Let's now cover an important exception to Medi-Cal enrollment. Some provider organizations or individual practitioners may either not wish to enroll in Medi-Cal or not have a pathway to enroll through the PAVE system. In these cases, they can still participate in the CYBHI Fee Schedule program, as long as they meet one of the following conditions. They are employed directly by an LEA or IHE participating in the program, or they are embedded or contracted by the LEA or IHE to deliver services on its behalf. In both scenarios, the LEA or IHE would bill Medi-Cal for the services, and then compensate the provider or practitioner through their employment or contract terms. This provides flexibility for LEAs and IHEs to work with qualified providers who may not be directly enrolled in Medi-Cal, while still remaining compliant with program requirements. Now that we've reviewed who qualifies as a designated provider or practitioner and the required Medi-Cal and NPI credentials, we'll move into the third section of this module, submission of the Standard Provider Import SPI roster file. In this section, we'll walk through the purpose and contents of the SPI file, how and when to submit it to Carillon Behavioral Health, what's the difference in traditional versus consortium participation models. This process ensures Carillon Behavioral Health can verify that all listed providers and practitioners meet CYBHI Fee Schedule requirements. Under the CYBHI Fee Schedule program, LEAs, IHEs, and designated affiliated providers are required to create and maintain a Standard Provider Import SPI roster file. This file captures information about all designated providers and practitioners who will be rendering services or ordering, referring, or prescribing under the program. Let's look at an overview of the SPI file submission process. First, an LEA or IHE will create the SPI roster using the macro-enabled Excel template provided by Carillon Behavioral Health, CBH, the state's third-party administrator. The file must include required information such as the practitioner's NPI, license type, and Medi-Cal enrollment status. Then, the LEA or IHE will submit the SPI file to Carillon Behavioral Health. Files should be updated and resubmitted as needed, such as when a provider is added or removed. In a consortium model, the lead LEA or IHE is responsible for submitting a combined SPI file on behalf of all participating members. Finally, Carillon Behavioral Health processes the SPI and conducts the credentialing and screening of each listed provider and practitioner to ensure they meet all CYBHI program requirements. Additionally, statewide affiliated providers, as approved by DHCS, must also be designated by LEAs or IHEs using an affiliated provider designation and acknowledgement letter. For more details on that process, please refer to the guidance for the participation of community providers. We've now reached the final section of Module 3, Frequently Asked Questions. These FAQs reflect common questions that DHCS has received from LEAs, IHEs, and stakeholders who are preparing to implement the CYBHI Fee Schedule program. We'll walk through each question to clarify requirements, processes, and next steps, especially around provider eligibility, SPI roster submission, and upcoming updates. Let's get started. How can providers and practitioners enroll in Medi-Cal? Medi-Cal enrollment is required for most participants in the CYBHI Fee Schedule program, and the process depends on provider type and delivery role. Here's how enrollment works. LEAs and IHEs must obtain a Type 2 NPI, submit a Provider Participation Agreement, PPA, to DHCS. Once approved, DHCS will enroll the LEA or IHE in Medi-Cal and add them to the Provider Master File, PMF. Designated provider organizations, examples being clinics and hospitals, must independently enroll in Medi-Cal Fee-for-Service, FFS. Enrollment is completed through the DHCS PAVE system. Website https://pave.dhcs.ca.gov. Individual practitioners must enroll as either a Medi-Cal Fee-for-Service provider or ORP only, ordering, referring, prescribing provider. Enrollment is also completed through the PAVE system. Once enrolled, providers must remain in good standing to be included in the SPI roster and eligible for reimbursement. Who needs to be on the SPI roster file of designated providers and practitioners? All designated providers and practitioners who will be rendering services and/or ordering, referring, or prescribing services under the CYBHI Fee Schedule program must be included in the SPI roster file. This includes embedded and affiliated individuals and organizations. Listing them ensures Carillon Behavioral Health can verify their credentials and include them in the approved provider network. How often does an LEA or IHE need to resubmit their SPI roster file to Carillon Behavioral Health? LEAs and IHEs are only required to resubmit the SPI roster file when there are changes. This includes adding new providers, removing inactive or ineligible providers, and updating information for existing providers. If no updates or changes have occurred, there is no need to resubmit the file that month. This flexible process helps reduce administrative burden while keeping records current. What is the process for screening and credentialing designated providers and practitioners? Once an LEA or IHE submits the standard provider import SPI file, Carillon Behavioral Health begins the credentialing and screening process. This includes reviewing each provider and practitioner's NPI and license information, ensuring all requirements align with the CYBHI Fee Schedule Program Manual. Carillon Behavioral Health will reach out to the submitting LEA or IHE if any information is missing, inconsistent, or requires follow-up. Can LEAs or IHEs include provider and practitioner types on the SPI roster who have not yet been approved for reimbursement under the CYBHI Fee Schedule Program? No. Only providers and practitioners who are currently eligible for reimbursement per the CYBHI Fee Schedule Program Manual should be included on the SPI file. Adding unapproved provider types can delay onboarding and claims processing. When in doubt, check with DHCS or Carillon Behavioral Health before listing a new provider type. When will certified wellness coaches, CWCs, and community health workers, CHWs, be eligible for reimbursement? On June 24, 2025, the Center for Medicare and Medicaid Services, CMS, approved State Plan Amendment 25-0014. This means CWCs are now eligible for reimbursement under the CYBHI Fee Schedule Program, retroactive to January 1, 2025. LEAs and IHEs may now submit claims for CWC services with a date of service of January 1st, 2025 or later. Include CWCs on their SPI roster, provided services are recommended by a physician or licensed practitioner of the healing arts, LPHA, within their scope of practice. Delivered by CWC1 or CWC2 as specified by the Department of Healthcare Access and Information, HCAI. Rendered as part of a care team under the CYBHI Fee Schedule program. Be sure to refer to the CYBHI Scope of Services document for the full list of allowable CWC services. Pending the approval of State Plan Amendment 25-0023, LEAs and IHEs are not currently eligible to supervise CHWs and therefore cannot submit claims for behavioral health services furnished by a CHW. However, some affiliated providers like community-based organizations may be eligible to supervise CHWs and submit claims on their behalf. Who can we contact for help with the SPI roster file? For any questions, technical issues, or guidance related to the SPI roster file of designated providers and practitioners, please contact Carillon Behavioral Health, CBH, at cybhitpa@carillon.com. CBH provides direct support for SPI submission, roster updates, and troubleshooting. This concludes the third learning module of the CYBHI Fee Schedule Program onboarding, focused on the provider and practitioner network. In this module, we covered who can be designated as a provider or practitioner, what steps are needed to meet credentialing and Medi-Cal enrollment requirements, how to submit the SPI roster file, and answers to frequently asked questions. Thank you so much for joining DHCS throughout this process. We really appreciate your time and commitment to improving school-based behavioral health access for children and youth in California. If you have any questions working through this module or need assistance, please reach out to dhcs.sbs@dhcs.ca.gov. Thank you.